The Brain and Spine Surgery Consortium in Abuja specializes in increasing access to neurosurgery problems such as neck pain, back pain, epilepsy, brain tumor, and conditions causing paralysis. For more information, call us on 081 2222 1616 or find us on Facebook.
And we're back. Thank you, Kachi, for the wonderful introduction. I have with me today Dr. Abiodun Ogungbo, as usual, and this segment is brought to you by the Brain and Spine Surgery Consortium here in Abuja. My name is Yechine Sasitsu. Dr. Abiodun is not alone today. Dr. Abiodun, welcome to the show.
Thank you very much.
Okay, I have again Dr. Douglas Oko. I hope I got that right.
Yeah, you did, Yeche. Thanks for having us.
Okay.
Thanks.
This is the clinic segment of the Lifestyle 360, and it is brought to you by the Brain and Spine Surgery Consortium. So I hear September 5th is Spinal Cord Injury Day.
Yes, you heard right.
What is that about?
The International Society for Spinal Cord Injury celebrates Spinal Cord Injury Day on the 5th of September, and this year falls on Tuesday next week. The key thing about this, of course, is to highlight and push the advocacy for patients who have suffered spinal cord injury. Mm-hmm. More important is to talk to ourselves, talk to the general public, talk to doctors, nurses, physiotherapists, talk to the government about how we can reduce the obstacles facing, or that people who have suffered spinal cord injuries face. There are huge problems, and unless you know somebody who has suffered a spinal cord injury, you cannot appreciate how bad things are, for these people. So 5th of September, Spinal Cord Injury Day, we need to push advocacy. We need to tell everybody, how bad things are, and hopefully help remove some of the obstacles. The theme for this year is actually yes we can. Yes we can. We can help to prevent spinal cord injuries. We can help to manage those who have suffered spinal cord injury right from the time of the accident, for example, and then when they get to hospital, and then we can actually look after them better in the hospital and at home, because they need sometimes continuing rehabilitation to get them back to their normal life again. So big issue.
Okay, you and I have talked about spinal cord injury a few weeks back, I think. Okay. And we talked about arthritis, wear and tear. Yes, when we talked about wear and tear, and these things just happen to you as you age.
Yes.
Now, what is the major cause of spinal cord injury apart from accidents? Is there any other thing? Because I don't know, is it something we can really prevent?
Yes, no, we may be mixing things up.
Okay.
Arthritis is different from spinal cord injury.
Okay.
People can have arthritis because as we're growing older, there's wear and tear going on anyway. But arthritis itself can damage the spinal cord. Yes, arthritis can damage the spinal cord. But what we're talking about when we talk about spinal cord injury specifically, we're talking about people who have been involved in a road traffic accident, or people who are falling from, climbing a tree, or somebody's falling down, or somebody's falling down steps, or somebody has a sporting injury, which has led to, damaging their spinal cord. So spinal cord injury specifically in this particular context means trauma or injury from a road traffic accident. That's, it is a catastrophic problem for, people who have suffered it.
Okay.
And it really damages lives.
Back to the theme. Yes, we can. Yes, we can. What exactly?
Yes, we can look after patients who have, suffered a spinal cord injury better than we're doing at the moment. Yes, for us in the Brain and Spine Surgery Consortium, we can operate on these people, quite safely. In the past, we were pushing that spine care can be performed, or spine operations can be done in Abuja, but the theme for this year, moving forward, is that this is the Brain and Spine Surgery Consortium, as a consortium working together with physiotherapists, with nurses, with other doctors, with orthopedic surgeons, neurosurgeons, all of us working together, to improve outcomes for patients with brain and spine diseases. This one is one of those issues where, there is poor care for people who have suffered spinal cord injury.
I think in Nigeria there's just poor care for everything. for everything, really. There's so much that we need to do. We're still paying out of our pockets for medical care. It's very disheartening. So, Dr. Oko, what if I find myself in that situation? What do I do?
Yeah, it's a difficult situation, and I think having this opportunity to actually advocate and actually promote the issues regarding spinal cord injury is very critical in terms of empowering patients and their families and Nigerians generally with information. If you were involved in such an issue, or your family, what would you want? You would want a situation where the average person who is around, one, the other key stakeholders, for example, the Federal Road Safety Corps, the NEMA, the police who will be around, or any passerby has an idea of how to actually of what to do at that particular point in time when a patient is involved in trauma. And Dr. Gumbo has just expressly stated what that means in terms of trauma: a fall, an assault, a road traffic accident, and all that. You would want a situation where any of these people I've talked about who are around understand the importance of pre-hospital care, what to be doing at every particular point in time. And I'll give you an example.
Okay,
of what
but
I mean.
Quickly, are they trained for this?
Well, first of all, the advocacy is important, because then you will now start knowing what the gaps are in terms of the training, in terms of the understanding of what to do and stuff like that. And that's why this is so important. So, for example, a patient might be involved in an individual might be involved in an accident, is in the car, maybe trapped in the car and stuff like that. People from the road safety or NEMA or whoever, or the first responders who are there at that particular point in time, should understand the importance of actually extricating that patient properly so that you don't cause further damage. Because it might be possible that the patient already has maybe a mild spinal cord injury, but if you don't transfer the patient, if you don't extricate the patient from the motor vehicle, first of all, properly, if you don't transfer the patient appropriately and try and protect especially the neck of the patient, you can cause further damage. So the question you asked me of, what can I do? Well, what would you want to be done is
because at that point you really cannot do anything.
You probably cannot do anything for yourself. Exactly. So the key issues of pre-hospital care especially are so important. How do you actually extricate a patient from a vehicle, or even if the patient is thrown out of the vehicle, for example, you want to move the patient from maybe by the side of the car or something to an ambulance, or what kind of vehicle do you even use to transport such patients?
I was going to mention that, because I see pictures where people have been in an accident and then they just put them at the back of an open van.
Absolutely terrible. Absolutely terrible. And that's why this advocacy is so critical and so fundamental at this particular point in time. And that's why this opportunity for September the 5th, Tuesday, is one that we should use to really advocate and promote these things. Unfortunately, because most of the time we as individuals or as people in Nigeria, we think that this can never happen to us. It sounds really far away from us until one day it comes closer home. Either it's you or a very close family member or a very close friend, and then you now see the importance of some of these things that we talk about. So pre-hospital care, very important. And the Federal Road Safety Corps, NEMA, the police, other sort of military and stuff like that, it's very important that capacity is built, in terms of training and stuff, to actually handle patients or people or individuals who have been involved in either a fall, a road traffic accident, or assault.
Okay, so basically, if I find a loved one or someone in that position, just transport the person carefully to a hospital immediately, or what are the first aid things that you need to do, that you need to administer at that time, just so that we don't cause further damage? Okay,
generally, if you find a patient, for example, maybe has been ejected from the car, for example, lying down on the side of the road, the first key thing is to be safe. Make sure that the area is safe, first of all. So even before you yourself go to go and help the patient, you must make sure that the area is safe. So you don't have something falling on your head or the car exploding or something else. So first thing, safety. Second thing is about protection of the neck.
Protection of the neck.
Yes, for the person, patient, of the individual who's involved in the accident. So the key thing is to try and, sometimes if the patient is even lying down, they just try and straighten the arms out and stuff like that, and they just keep the neck in what we call
Do
the
you,
neutral
do you
position.
prop the head
Well, no,
onto something?
Don't prop the head. Don't do anything. Just keep the head in what we call the neutral position, which is the back of the head lying on the floor and looking upwards.
Okay.
That's the best. We call that the neutral position. If the legs are splayed and stuff, I mean, you just
bring them back
in
together.
fact, because most people are not trained, you probably shouldn't be doing much. One of the first things you should be doing is to actually get people who actually have an idea of what they're doing to actually come in to help. And that might be the Federal Safety Corps, it might be the NEMA, it might be the police who's around and stuff like that. But that thing that we see every time where someone is involved in an accident, everybody shout, hey, they carry the person's head is dangling down and stuff like that. That can definitely cause more harm to the patient. So the first thing is try and keep the head in, like I said, that neutral position, what I've tried to describe, with the head, with the back of the head touching the floor and the head looking up, and then call for help. But the key thing is always be safe first, to make sure that the area is safe.
Okay.
And stuff like that. So it's about calling, making sure the area is safe, putting the head in a proper position, and then calling for help.
Call for help. Don't try to play hero, except if you find yourself in a position where you really cannot make a call or something. And then I think we should do something on maybe ABC of safety or something.
No, absolutely. Absolutely.
Dr.
Resuscitation training on CPR and stuff is very, very important for every Nigerian to
just know the basic care.
To actually know the basic care.
What to do, just in
what
case.
to do in that first instance before you actually make a call.
Okay, thank you so much. Time has gone, but Dr. B, anything you want to add quickly for the general message for today?
The general message is we need to do more and we need to do better for patients who have suffered a spinal cord injury. One important thing, of course, is that hospitals that have no capacity, no skill, no expertise in managing patients with spinal cord injury, then please don't be looking after these people, because you can be doing more harm. Refer them to the appropriate specialists.
Okay. Please don't do anything that will harm the next person.
Don't add
Don't add to the person's troubles. Please, we're pleading now. Please, I'm on my knees, not literally. Anyway. But thank you so much for being on the clinic segment of Lifestyle 360. Every Tuesday we have this. You want to add something, Dr. Oko?
No, I just want to say thank you for providing this opportunity for us to actually empower Nigerians with information about how to manage these patients with spinal cord injury. And I hope that the 5th of September, being the Spinal Cord Injury Day, we can use that for a lot of advocacy regarding this issue, because it can affect any of us, either individually, family members, close friends.
Okay, to be religious, God forbid. But arm yourself with information, just like we're doing right now. We're giving out the information, so arm yourself with information just so you know what to do if you find yourself in that position, or you find a loved one in that position, or whatever. You find someone you don't even know, but because you know what to do, you will know what to do. So thank you so much for being on the clinic segment, Dr. Oko.
Thank you, Eche, for having us.
Oko, he's a neurosurgeon. And Dr. Biodun Ogungo. Every Tuesday we have this, and this segment is brought to you by Brain and Spine Surgery Consortium. My name is Yechine Sasitsu. We'll see you next week.